Hello everyone, I'm Claire Williams and I'd like to welcome you to the next in our series of discussions about all things safety. And tonight we're going to talk about horse health. Tonight we're talking about something that affects really every type of grazing animal in the UK, and that is internal parasites or worms to most of us, and how we can manage them better. I'm delighted to be joined by Claire Shand, who's Director and SQP from Westgate Labs. They're a company specialising in parasite control for horses, and they've been advocated what we call as a test-based approach for the last, I can't believe it's over 25 years, Claire. You've been doing this, not you personally, but you have been doing this a long time. Now, this is a very timely chat because I think we're all a lot more aware of the need to really take a more strategic approach to the way we look after our horses. And British Veterinary Association, the BVA, recently issued a new policy position which was calling for a more evidence-based approach to the way we control worms in our horses. And it did highlight the need for species-specific best practice groups. And we've always had SCOPS, which deals with sheep. We've had cows, which conveniently enough deals with cattle. And more recently, we've got CANTER, which is for horses, as a way to develop strategies for us to tackle drug resistance, as well as reducing the environmental impact that the medicines we use have on the land and the species around us. Now, CANTER is an industry-wide group that both Claire and myself are on the core steering group for. It was formed 2 years ago, very much helped by the Veterinary Medicines Directorate in its initial stages, and it's published its first guidelines on sustainable equine parasite control about almost a year ago. So there's lots been going on, hasn't there, Claire? What's your take on this?
Yeah, hi Claire. It's really nice to be here to chat worms with everybody. Just our favourite subject. So yeah, it's so encouraging to see all of these initiatives coming together and everybody's so aligned with the messaging. You know, as you said, we've been saying this for a long, long time now, but really there has been like a shift change, I feel, with it. And so everybody is on board with this. And CANTER, as you say, you know, pan industry. So we've got vets, researchers, welfare, horse owners, laboratories, pharmaceutical companies, like you name it. And it's just brilliant to get everybody pulling in the same direction, same message. So yeah, things are changing. There's lots to do, but yeah, it's exciting.
Yeah, it is. And because we have seen a real sea change in the approach, you know, from, 40 years ago to today. So how has that approach changed? And we've got some slides, we'll pop those up. What are the key themes of how this change has come about?
Yeah, I mean, it has been evolving, I guess, over the years. So we started back in 1999 as officially as a business. So it's a family business. So it's my mum and dad that set it up. They started to test our horses and then develop Westgate Labs kind of as a lone voice, you know, back when we were really doing a lot of strategic plan, like, you know, every 8 or 12 weeks chemical worming. But now it's really great. The BVA have come out today and where's the little, here it is. Yeah, it is that slide. And with these bullet points but they're so aligned, as you say, with CANTER, with the work that we're doing, with what other experts, researchers, parasitologists are also putting out there. So everybody testing first. So really the worm egg count and our take mum tests and everything else, absolute cornerstone of good parasite control. Targeting our treatment, so only giving it to the horses that need it when they need it. So none of this blanket worming, treating everybody, treating just in case. Where we do need to treat, like really choosing the correct chemical, getting the dosage right. And that's for the individual horse, the parasite, the time of year. So we've started to talk really about this horse first approach to that. And all of the factors that go into choosing that, you know, you can talk to your prescriber, your vet, your SQP, your pharmacist to help with that. And then prevention via pasture management. So really looking at how do we manage our horses, poo picking, resting, rotating, not overgrazing, where do we put our muck heaps, can we cross graze or put sheep, cattle, anything else over that pasture, just to help to break the life cycle mechanically without us relying on the chemicals. And then this is a really interesting one, nutrition and immunity. And I know it's something that you've been doing a lot with as well, with nutritionists and things like that. So healthy horses, building that resilience to parasites, and something that we talk less about, I guess, with horses than we do with some of our other animals. But again, the right exposure. So things like ascarid, we can think of those as young horse parasites that they can get an immunity to when they get over to the age of 4 or 5 generally. So they're exposed to them and then they gradually become immune. So that's that sort of thing there.
And I think it's that whole health approach, isn't it? Because if you've got a healthy horse, then they're better able to actually have a certain amount of worm burden, because we're not trying to get rid of all worms out of horses. For them to have a certain level of worm burden is healthy, but it's the weak horses, or as you say, the young horses or the elderly horses, that suffer the most. So that's where nutrition and all-round health awareness is really important. And we've mentioned SQP. You're an SQP, I'm an SQP. Perhaps could you just explain to those who might not know what those magical letters mean, what they actually are?
That abbreviation, SQP, stands for suitably qualified person, which really basically means that we have studied, taken exams to be able to advise on this small part of veterinary medicine, and therefore there are products that we are allowed to prescribe. Most of those are our worming treatments, our anthelmintics, which means that they're easily, readily accessible to horse owners and to other animal carers who need them at the coal face, really. And it helps to take pressure off vets who obviously have a lot of other things that they do within their day-to-day. So we're just part of that army, that fight against this resistance and this change that we need to see.
Yeah, exactly. That's really important, because it's an area, and I think we've got to really, really look after those tools we have in our toolbox to fight worms. We've got to really look after them, because I think there haven't been a lot of new wormers, anthelmintics, that have been released into the market. And so the horses that have been overdosed, or, you know, as you said before, you give your wormer every 8 weeks. That was, you know, almost what we were taught. So we've got to unteach that approach. There isn't really that much innovation, but you have got innovation in other ways. And you've actually launched a new test, haven't you? Which is really the first type for some time.
Yeah, you're absolutely right. We're going to go on and look at the state of our chemicals and the resistance problems that we've got there. But the really good news is that within the evidence-based, the diagnostic tests, we've got more and more developments happening. So the small red worm blood test came on board in 2019. And for the first time this year, we've launched a large strong-gale larval culture test, which we're going to go on and talk about as well. So that hasn't been available in the UK up till now to help us differentiate between our small and our large red worm. It has, unfortunately, it's becoming more necessary for us to look into this again. But yeah, we're going to talk into that in more detail later. And so what's going on?
Yeah, and so we've talked about, the need to change and the worry about the resistance that our horses are building up and why that poses a risk. So why do we need to change, and how would you detail what is anthelmintic resistance? We all know it's a huge issue, but how have we got to where we are now?
Yeah, resistance basically means that the worm itself becomes resistant to the standard dose of treatment that would be given it. So instead of the wormer killing it, stunning it, making sure that it passes out of the horse, that standard dose is not effective anymore. So that worm, the dose goes into the horse, the worm is unaffected, and it carries on to reproduce and cause the damage in the horse that enlarged burdens worms can do. So it means that they become ineffectual. So we're just putting wormers in our horses and they're not doing what they're intended to do. So this is our little diagram, which looks really complicated from the outset, but actually if I can just talk you through, we've got 5 chemicals down the left hand side, and they're all of the chemicals that are licensed to treat horses for worms. And then across the top we've got all of the worms that we'd be looking to treat those parasites there. And unfortunately, every time I update you with this one, we get a few more that are unticked from green and going into these more concerning stages. So you can see our oldest chemical there, fenbendazole. You'll know that probably more by the name of Panacur, which it goes by. And you'll see really that pink there against both adult and larval stages of the small redworm. But then worryingly, if we go down there, Pyrantel is orange, and we've actually now got ivermectin, moxidectin as yellow as well. So there's been like recorded resistance to all of those chemicals. So we now don't have a treatment that is absolutely effective against that parasite. And with it being one of the most numerous and very dangerous, I think that's a big concern.
Yeah.
But then
Sorry, no, I was going to say, and it is a concern, because I think for a lot of people, if you compare it to the human and also equine equivalent of the increased resistance to antibiotics, we're talking about a similar sort of thing.
Absolutely. Yeah, it's antimicrobial resistance, which it encompasses bacteria, fungi, viral, and our parasites as well. So yeah, it goes across the board. We're seeing this. You just got to talk to anybody in the medical profession and they will tell you like similar horror stories that they see daily about this. So it's a really big problem across the board, and it's going to cost lives, cost money, we've just got to be more proactive about using them when we only need them, rather than across the board, and like reducing that exposure.
And as you mentioned before, I may have mentioned it, that the chemical classes, there is nothing really new on the horizon, is there?
Sadly not. There's not really the investment in the equine sector that we would like to see, similar to what there would be in the food industry. So they are really trying, particularly for sheep and cattle, because that's where the money is, unfortunately. And some of these more, well, I call them more modern. Our moxidectin was released in like the late 90s. So it's not new anymore, really, is it? But a lot of these wins have come from the agricultural sectors, but the most recent wormers they've developed for sheep are toxic, unfortunately, to horses. So we're not going to win there. There are some thinking that there are some tannin products that they're looking at. There are some fungal things like that, but how you kind of get those to dosing and licensing and everything else is, that's a big leap. There could be other developments, but yeah, it's a long way away yet. So we really need to take care of what we've got. That's the key message here with our resistance problems.
And the other factor is that at the end of the day, these medicines are all chemicals. So wormers aren't actually that great for the environment, are they?
They're not great at all, unfortunately, because they do the very same thing out of the horse as they do inside. So we've got our ecotoxicity kind of as on a scale of baddies, I guess. Ivermectin on the left, they're being the worst, down to Pyrantel, but they're all poisons. So we've really got to start to think about what we put in the horse at the front end comes all the way through. And there's quite a scary diagram here about how wormer is administered and then the impact that it has. Because when I started to look into this a couple of years ago, I was just horrified to learn that if you put an ivermectin wormer in the front end of a horse, up to 95% of that goes all the way through the horse and is passed out in the dung without being metabolized by the horse. And then things like dung beetles, which are the first on the course, and then are invertebrates, they leach into the soil, they get into roots of plants and reduce germination by like 30%. So they're really having a big impact, and they get washed into watercourses, again, where they're highly toxic. So it has a really huge impact. And so by just targeting wormers where we need them, helping to leave some piles that are not toxic, if you like, to our dung beetles and things like that, to give them, they need these for habitat, for breeding, for all sorts of beneficial elements, and we need to be very careful. So if we can keep horses off the field, off the pasture for peak excretion time, which is usually between 24 and 48 hours after the worm has been administered. So not the first 24 hours, but 24 to sort of 35, 48, and do our poo picking really religiously, get that poo off into a compost heap where you can thermophilically compost it. So that's above 60 degrees. That starts to break the particles down and stop them being active in the environment as well. So just, being really careful about that.
So we all know we need to worm less often, but doesn't that just mean worming less frequently? Or what do
that would be the approach you would think, but what that means is that the worms, the life cycles are so fast that actually a problem can quickly get out of hand if we're not monitoring that and keeping an eye on it. And if you are just going to step in with our chemical, like which one do you choose? We've now seen with that resistance table that there isn't a chemical that's really good at everything. So the moxidectin, which is our most recent chemical that we've got, is probably our most effective for that and ivermectin for our small redworm, but it's really not so good now for resistance with our ascarid for young horses. So we've always got to balance which parasite we're treating and looking at that risk profile of that horse that we're going to go on and talk about, and putting a program in place to protect them is the best way forward so we don't get these problems with parasite burdens building up, which can be really serious.
Yeah, and that's why I suppose we all are now looking at that change of approach rather than it based on time, actually base the program on need. And so which horses need to be wormed and which and how often, and that's where a test-based approach is much better because you're actually assessing the risk, aren't you?
Absolutely. Like, let's not just guess, let's use science, evidence-based, and then we absolutely have a baseline for it and we can base our decisions on that. So much better. Knowledge is power, right? And I know that we've brought out as Canter these guidelines for parasite control, which is aimed at prescribers, and that's been brought out alongside a risk profile to actually enable us as owners to understand how our horses may be at risk and use that to equally talk to our prescribers about that risk approach. Yeah, absolutely. So using the Canter acronym, they've come up with a really brilliant way of just assessing all the different factors that you might not even take into consideration when you're looking at, what does the horse in front of me need? So we look at clinical history, which really boils down to, is there anything else going on in that horse that could compromise its immune system and therefore, as you said earlier, Claire, make it more vulnerable to these parasites? So things like PPID, known as Cushing's, EMS, any problems with resistant worms in the past, like all of these things can have an impact on how susceptible they are to parasites. The next one would be age profiling. So again, we've said the young and the old, especially, their immune systems are just, for the young, they're not developed properly, and then that can start to decline as you age, and therefore, those parasites can get a hold just much more easily than they might in a healthy adult horse. The number of horses that we keep together, again, really key. The more you've got, the more parasites that you're likely to have, because they can bring them in when they go out training, competing, that sort of thing. If horses are coming in and out, buying and selling, then they're all going to be moving parasites around, and we've got to start to look at them as transmissible disease. So horses can bring parasites with them and then just, very graciously give them to all their field mates, which is lovely, isn't it? There's a study done a few years ago of thoroughbreds from Ireland that took resistant worms when they went to their new home in Kentucky and infected a whole yard with resistant parasites that the yard didn't have before, which not what you need. No. Then we look at our test results, because we find that 80% of the worms are in 20% of the horses. And by doing these regular tests, you can start to identify they're what we call high egg shedders. And just for whatever reason, they may be more susceptible to parasites than the other horses that are there. So testing helps you to identify them and to do something about that and keep a close eye on that. And then environment really matters as well. So our stocking density, is it poo picked? Can we rest and rotate the grazing? Those sorts of things are all factors that would play into that. And that all adds up to give what we call it the risk profile of low, medium, high. And you can see here these risk factors that we just discussed, and then some parameters around that. So I'd really encourage everybody to go to the Canter website. You can download this and you can then start to assess, well, where does my horse sit into this? If you've got some that cross a border, go up. So if you've got a horse which, for example, it's a healthy adult when you look at the age profile, but on medium stocking density rather than low, or you don't poo pick as often as you might be ideal, then put that up into the medium category and treat it appropriately. And this starts to help us to look at, well, how do we then design a program that's going to help to protect them? Keep an eye on that worm burden.
And just picking up on a few of those points, poo picking frequency, what is the guidance on how often you should poo pick?
At least twice a week is guidance for that. So it's really before the eggs are hatching. So we need to get that off the pasture, because otherwise those eggs hatch, the little motile larvae will wriggle away from the worms, then they're in the grazing, and that's what the horse is picking up when they're grazing and infecting themselves again with the worms that grow into the adults. So
yeah, and because I know you said before that the dung beetle needs dung to live in. So whilst it sounds great to do it every day, actually you're removing the habitat for the dung beetle that they need, isn't it, if you do take it away immediately?
It is a balance. Yeah, you're absolutely right. Where you've got an active dung beetle population, then if you can leave the freshest, so like the 24 hours, it's a balance really, isn't it? But for habitat and for parasite control. So we're always scratching our heads. Do we leave this on? Do we take it?
And then you lift it and find a dung beetle underneath and you think,
yeah.
And resting fields. I know we've talked about that before. How long do you realistically need to rest a field for it to be effective?
Yeah, again, it's a little bit of a how long is a piece of string. It will depend on a lot of things like weather. Is it dry that helps to desiccate? Is it cold? Or, all these different factors. But I think, if you can rest for 3 months, that's great. If you can do 6 months, that's like even better. If you can leave it for a year, that's ideal. But people just, a lot of us just don't have that capacity. So we do what we can,
Yeah.
Got to be practical too, unfortunately.
And then just one, because I know this has been an issue before, those people who have what I call closed herds. So at home, we've got a closed herd. We have 4 horses. We never bring any in or out. They're by themselves. So what's the position on closed herds? Because you're absolutely right. We have one. We test regularly. One of them always has a slightly higher egg count than all of the others. So, and a lot of people think, well, I've got a closed herd, so I don't need to do anything.
Yeah, I wish that was the case, to be fair. I've got a high egg shedder, I've got a Highland pony who, just anecdotally, they do have higher worm egg counts often than some other breeds. Yeah, along with Arabs and Frisians and some other breeds as well that just we notice. But anyway, again, he's in a closed herd and he does have asthma, which is a systemic condition which affects him, which I think might play into that just now. But yeah, I've just done my worm egg count and he's over 500 and he will need a wormer. And he's poo picked every day and it gets everything that I can give him, but it's just they just are all around us in the environment. So I don't know where they come from. We had a horse recently, he had pinworm. Again, he doesn't go out traveling anywhere, he just hacks from home, but they're just there, aren't they, parasites? And we cannot get rid of them, we cannot eradicate them. It's just a fact of managing it.
Now, we've got a question. Are you happy to take a question now?
Yeah, go for it.
Yeah, okay. So this is from Sarah, who asks, other than regularly testing droppings and saliva, is there any other ways we can identify worm issues?
Yeah, really, it's about doing your testing. So the different parasites will have different symptoms to look out for. But if you're seeing symptoms, it's usually the burden's quite big. You'd want to be picking it up before that. So actually should we go on to the suggested program and how we sort of look into the different elements of that? Yeah, so well, we'll do this bit first. So these are all of the parasites that horses can get. So our small and large redworm, ascarid, tapeworm, then encysted small redworm. I've separated that out because it's a particular stage of the small redworm that we really need to be mindful of. Large redworm, and again, we will talk about that and the new test that we've got for it, because the worm egg counts don't differentiate between the small and the large. And then they can also get liver fluke, lungworm, pinworm, bot. So they're more the incidental. So the top line are really our most pathological, the most likely to cause disease, the ones that we really need to keep an eye on and do that regularly. And we're going to look at doing that by putting together a test-based program. So we looked at our risk there. If you've got a healthy adult and they're in the low risk category, probably every 12 weeks for small red worm egg counting for small redworm and ascarid is where you'd want to be. You can shorten that to 8 weeks if you've got a higher risk horse that goes out a lot competing or is young or particularly old with immune problems. And then in the late autumn winter, then we're going to look at what do we do for the possibility of our encysted small redworm. And that again will depend on risk. Now, I'm not a fan of the do nothing approach. I think you can use the blood test with your vet, which will determine whether you need to give a treatment or not, or you give a proactive larvicidal. So particularly for those larval redworm at that stage of the year, that would be the only annual dose that for those medium or high risk horses that we would be recommending. And then every 6 months doing our saliva test for tapeworm, because the worm egg count again is not definitive for that. So that's either spring and autumn or summer winter. And the reason that we've changed our plan a little bit, if you've seen this visual before, is that because of the difficulty now of getting praziquantel, which is our tapeworm only treatment, some people would prefer to test before they give that winter dose to decide on whether they give the single, so you can get moxidectin only, or you can get the moxidectin plus praziquantel, which is an easier way of getting that particular chemical if you need it. But it really depends on your yard and how you run that in terms of like the horses on it, the management, whether the horses you want to give you're comfortable giving a dual chemical, whether the horses are better splitting those doses. There's so much to consider on it, but we're very happy to talk to anyone about that to help you determine like what's the best way for it.
And when you were talking about, before you mentioned the large redworm, where does that, what time of year would that be you've noticed some symptoms and then you think you may need to undertake that test?
Yeah, I'd really be just putting that into your schedule. So to do your worm egg counts and your tapeworm tests as normal. There were certain things like if you've got a horse that's itching its tail, that might indicate that you had a pinworm problem, for example, and you could use a tape test to determine that. If you've got a horse that's coughing, there are 2 parasites that might cause that. So we've got, flick on this one, yeah. We've got our ascarid, which has a migratory stage with the larvae. They go to the lungs and can cause coughing, particularly in young horses. You'd watch out for that. But if they're grazing with donkeys, that could also be a lungworm problem there as well. Now, lungworm are not a good, or the horses are not a standard host of lungworm, so they don't reproduce very well. So we can do a Bayerman sedimentation test to check for that. If you're seeing coughing in the horse, go with the donkey that it might be grazing with, because they're more likely to be egg shedding. But donkeys being much more stoic, they're probably showing no symptoms, where the horse is the one being a drama queen and, you know, doing that bit of coughing there. So that's something to watch for. We've got liver fluke, which is not a common parasite of horses again, and you're only really going to likely see it if they're grazing very wet pasture, which has got those reedy kind of grass stalks in, with sheep and cattle, because that parasite needs a little mud snail to reproduce as part of its life cycle. So it needs all those things present, but it can be quite a difficult one to diagnose in terms of like whether they have liver fluke or not, because again, they don't lay eggs very rapidly because they're not the best hosts for it. But again, if you've got sheep and cattle and they're showing signs, it's basically anything that impacts liver. So kind of just generally malaise, not looking themselves, not keeping weight, that sort of thing, then you might suspect a liver fluke problem for those. And you can either do an ELISA through Liverpool University, do that, or there is a fecal test as well. But as I say, it's not as definitive in horses because they're not the natural hosts for those. So.
No, and if you've got these issues, you could either discuss it with an SQP or ask your vet if it's very specific. We do have another question, which I think you've sort of covered, but I'll ask it because it's always good to highlight these things, because I think most people aren't aware of the huge variety of worms that our horses face. And Debbie's asking, do worm egg counts cover all worms other than tapeworm? I use a company, not Westgate, to test, and it only ever seems to show strongyles.
Yeah, strongyles would be the most common. So really, the worm egg count is testing primarily for your redworm and your ascarid eggs. So we do see tapeworm, and if we see it, we will report it. But because of the way that they are excreted in the dung, in packets rather than distributed really widely, you can't definitively say that there's no tapeworm present if you don't see any eggs. So we don't obviously see the encysted small redworm because they're larval, so they're tiny larvae and they will be in the gut wall of the horse, so they're not laying eggs and therefore not detectable. You may see liver fluke, but it would be rare. We tend to need a different solution, and we would have a larger fecal sample for that. Same with lungworm. We use a different test for that because their eggs are heavier, so we would use a sedimentation test for it. And again, it's very occasional to see pinworm eggs in a worm egg count because those parasites, although they live in the gut, the females actually go on a suicide mission and they lay their eggs externally, like around the anus of the horse. So you wouldn't normally see those unless some had got mixed up as it came out and was shed or whatever. So that's for that. And then bots is it's not a true parasite of horses, it's actually a fly, but they have those little red armadillos, if you've ever seen them, passed out in the dung, and they do have a stage where they overwinter basically in the stomach of the horse, and they will attach onto the stomach. They're not thought to be very dangerous unless they're in really large numbers, but they could, because of where they are, potentially be an aggravator for ulcers if you had a horse that was prone. So if you see those little eggs that are laid on the horse's coat through sort of late summer, autumn time, then you can't treat for them straight away, but when you give your winter wormer, then give something that would treat bots at the same time would be the recommendation for that one. So it's all about using the tests that we've got, but within the knowledge of their limitations.
Yeah, I think that's key. And then you mentioned before something about reduction testing. That is really it's a tool to check for resistance, isn't it?
It is absolutely that. So usually done with a worm egg count. So if you had a worm egg count that was very high and you knew that you then wanted to go in and give a treatment, you could then 10 to 14 days after you'd given that dose, then do another worm egg count, and that is known as a reduction test, and it will help to give you an indication of, has that treatment been effective? So how is that chemical performing on your land, and has it brought that count, that egg shedding down? Now, if you're still seeing a high count, it could absolutely be chemical resistance, and we want to report it if it was the case, but we also would need to be asking ourselves questions like, did the horse get the right dose? Was any spit out? And what about the weight? Because if we, for example, have a big chunky warm blood or draft horse and we dose it for like 500 kilograms, it's not going to be sufficient because it's going to weigh a lot more for that horse, and therefore that's just not going to be effective, and it probably isn't going to have treated the burden that's present. So they're really good to do. A little bit harder with tapeworm, so the Equicell test is the best way of doing that because saliva regenerates more quickly than blood, but you'd be looking at waiting 3 months is the recommended time between those, and so you wouldn't really know, because tapewormers treat the adults and not the larval stages, whether there was larvae there that you'd taken out the adults with the treatment and they'd been ready to grow on and into adults, or whether there was some reinfection present. So it's not as an exact science and harder to test for, but you can do it and monitor it. And for that reason, putting in some regular tests, if you get a very high Equicell, sometimes you do need a bit of test and treat over a concerted time to see that come down. So Yeah.
And you just mentioned before administering the right dose, so making certain that you do know how much your horse weighs, so that you give them the right dose. Because if you underdose, in effect, you're helping the worms to build up the ability to resist future doses in the future, aren't you?
Absolutely. Yeah. It's just an exposure that doesn't count. Yeah.
Yeah, exactly. And then we talked before about the large, stronger larval culture. Tell us a bit about that.
Yeah, so this is a really interesting one. We had, with our strategic worming that we've done since the 1960s, largely eradicated the large redworm from this country in the UK, which is fantastic. We didn't have to think about it. It is a very dangerous parasite. It's known as a bloodworm, and it is so dangerous because the larval stages actually migrate through the main arteries of the horse from the intestine, and they're blood feeders. So as they go, they're munching on the arterial walls, in organs, and that sort of thing. So they cause a lot of damage in large numbers as they're migrating through the horse. And then you can imagine, if you've got a weakened artery, it can do things like cut the blood supply off to the intestines and you get this colic, or it can do things like cause hemorrhages and infarctions and blockages and things like that as well. And we often see with the large redworm, like sudden fatalities. So if you think about when those arteries are under pressure, either in broodmares or if a horse is galloping under kind of high intensity exercise and you've got a weakness there, then that's when they can go. And so really, like, very, very dangerous parasites, and nicknamed the colic worm because of the law of, the fear of, older vets will know of this parasite, but we haven't really heard, talked about it for a long, long time, because we've been so lucky that because it's got a very long life cycle, we haven't really had to face that in the UK. But our need to reduce our wormers because of resistance and all these other problems has kind of opened the door a little bit, and you can then add in this increase of transportation of horses around the world. So imports where they have not had the same impact of us. Then we talked before about the fact that you can bring these worms in with traveling horses, and it seems like the possibility is that the door has opened. And certainly we know, when we look at studies in Sweden, that back in 2008, when they first tested horses, like large population tests for large redworm, they were finding very low incidences of that, around the sort of 8%. And it's now, when they went back in 2015 with the targeted practices, because in Sweden it then became illegal for you to give or you couldn't do it. You couldn't get a wormer without a worm egg count or some test that says, I absolutely need this. So they really reduced, like, across their horse population, then they reduced their worming that they were doing. And so then it just opened the door. And when they retested the horses in 2015, doing these like wide numbers of horses, they were then finding sort of 50-60% of infection rate of large redworm in horses, which is a big worry because of the dangerous aspect that we just talked about. And the diagnostic challenges of it is that this is a strong guile egg, and that could be a large or a small strong guile. And when we do a worm egg count, we can't tell. It didn't used to.
The small ones are okay, and it's the large ones that do all the damage.
The large redworms, yeah. And so the difficulty is that because of resistance, we've now got to a place where we leave small redworm burdens untreated, because we know that a horse can deal with a sort of a low burden of parasites, and that they're not going to cause them undue harm. We're going to want to treat when we get into the higher, so medium high worm egg counts. But because of the danger of the large redworm, if you saw any presence of them, you're going to want to go in with a treatment. So that's the difficulty, is how do we navigate this new development potential without just going back to routine worming? Because we can't do that, because it's going to, absolutely break us on the small redworm front. So we need now to start to differentiate between them so that we can be as effective as possible and balance this risk and the resistance that we've got. So there is this method called large strong guile larval culture. So we take a fecal sample, we put it in this, you can see it here, this incubator, We did think, oh, why is there a nice drinks fridge arrived in the lab last year when we started doing this? But no, and that incubates the samples, the fecal samples. And so any eggs that are there are going to hatch into larvae. And it's these larvae that we can then look at under the microscope and differentiate those between large and small. And then we can identify, is there a problem or not? And where do we go with that? So it's the most cost-effective way that we have of doing this. The other alternative is a PCR test, but that's not available in the UK currently, and it's also much more expensive. So this is quite a time-consuming, it needs quite skilled personnel, but it's really something I think we're going to start to screen for probably annually for high-risk horses. So
just about to say, so if obviously if you're worming counting every 12 weeks, but who or when would you look at this additional test?
Yeah, so initially it would really be the high-risk horses, and so that absolutely, as you would imagine, is going to be studs and breeding operations with young stock, because they're just hotbeds for worms, unfortunately. If you competitions and sales, especially if you've got overseas movement of horses coming in and out, then yeah, you would want to be starting to do some annual screening. And then anywhere with high stocking density, recent horse introductions that maybe hadn't had the best parasite control, that sort of thing. So any horse that's you're going to think it might be wormy. But then conversely to that, if you've got horses kept on minimal or selective worming schedules, so we talked about these very closed herds where we still see parasites because they're there and there's potential, it might be something to start to think about as well if you're on a management regime where really you hardly give any treatment at all. Because again, that's just going to open that door a little bit. So you can test individual horses, or we can look at composites from horses that are grazing together, and that would be up to 4 horses, which again starts to bring the costs down when you're looking at putting this into a program and making it more manageable.
Yeah, that does make sense as well. Just a question as well that's come up. And with some clarifications, so thank you for that, Debbie. If your count comes back showing medium to high, so that you need to treat with a wormer, she's asking which wormers are suggested to use either in the spring or the autumn winter. And I think you've sort of covered some of that, but it might be useful just to highlight, because again, it's not necessarily which wormer, it's which active ingredient in the wormer you need to think about.
Absolutely, yeah, and that will also depend on the horse and the situation and the time of year and the different other testing that you might have done. So for a healthy adult horse, generally, if it's not a winter dose, we're going to stay away from anything that treats larvicidal, because we want to really protect those as key medicines. So ivermectin is a very good treatment for our redworm, adult redworm. And in an adult horse through the grazing season, if they've had something for their winter dose or had a test that showed they didn't need that, then that would probably be our first port of call for it. You might start to think about other options if the horse was a youngster, and it might have the potential for ascarid, or you're looking at things like, has it had a tapeworm test? Are you going to do an equisal? And therefore, when was the last tapeworm treatment? What's the likelihood of, those sorts of things. So if you've done a test as well and you need to treat for tapeworm, you could use an ivermectin praziquantel, or in certain situations a double pyrantel. So that would be like a Strongyp P or an Embotape, something like that might be more suitable. So there's a lot of different factors that would go on to a decision-making process, and that's why worm is a prescription medicine. So really have a chat with your prescriber and talk it through, because there's not necessarily always one right answer. There's a few different roads to Rome, but as long as you're having those discussions and you're making those balanced decisions, then that's really going to help you to choose the right worm at the right time of year for the right horse. Yeah.
And I think, just you saying that really highlights the complexity of the picture. Is that there are so many variations, and you've also got to think about the rest of the herd if they're kept in a herd. So, I think it's really important that if you do these tests, you go either back to the company that's done the testing, if they have SQPs that can talk to you about your program, or you go in and consult a prescriber and give them all the details. And that's why when you go to purchase wormers, you are asked lots of questions, because equally the guidelines now say that we should not be prescribing wormers unless there is evidence to tell us that there is a need for them, and that is generally given by egg counts. And we haven't quite got to the Swedish stage, but who knows, if we don't change, that may well come in the future.
Yeah, you're absolutely right, Claire. And again, it goes back to our reduction testing as well. So there might be certain properties where we know, right, so there's a particular resistance to this particular chemical, and therefore you might change your approach based on that as well. So again, just gives you such good information because it's so localized. You know, we hear that there is a lot of resistance to things like fenbendazole and Pyrantel, but actually there are some places where they haven't been overexposed where it's still very effective. But so it's just, yeah, we deal with a stud where they've got a Pyrantel resistance issue, and so particularly for their young horses, that gives a challenge, because when we've got horses or youngsters from sort of 8 weeks through to 6 months, we would want to proactively support them with some treatments in that time, and we'd normally do that by alternating fenbendazole and Pyrantel. But if you've got Pyrantel resistance, there's absolutely no point, and therefore that might be when you'd start to think, you know, I wouldn't normally consider ivermectin as a choice in that time, but you start to you do think about that when you know you've got those particular problems. So you're just always weighing up that the whole context of what and where and everything else. So really important is why to get these tests in and to do them regularly. It gives you such good information.
Key. And another one from you, she's thanked her. That's very, well, thank you, very informative. She's got a 3-year-old that's been consistently tested. It's interesting, a young horse, medium to high, and positive low Equicel. She's been wormed with Equus Pramox and 5-day courses of a liquid, and she's at a loss what to do next. So it's interesting because that is just an example of how complicated the scenario can be.
Yeah,
she's waiting
absolutely.
on a count result now. So
okay. Yeah, it's all the different factors. So it's really difficult to say without having an in-depth discussion. So we'd be starting to talk about the living arrangements, like, you know, where is the horse, who is she grazing with, could there be a high infection on the pasture, what's the poo picking and the management like, could anything be coming in that is causing exposing to risk there to infection, and then once you're giving the treatment, are we doing reduction testing? Are we to see, has that treatment been effective? So could it be that are we giving the right dose? Could anything be interrupting that? Could there be spit out? Anything else like that might be occurring? And if that's the case, are we doing reduction testing? Could there be some resistance? And what chemical resistance might we be seeing on that horse? And then what else is going on in the horse's immune system? So what could we do there to bolster the immunity, to make the horse as healthy as possible to resist that? You know, we've had incidences here actually with one of a colleague's horse where we had a real spate of again, it was a young horse. We had some resistance issues, so we were treating, you know, with ivermectin, with moxidectin, and the counts were going up and up and up, escalating. The vet was involved because as SQPs we have to go off the book, and we can only do we can't do the wormers more regularly than what's advised on the licenses, and we were having to treat this horse more regularly than that to get on top of these burdens. And then all of a sudden, for somehow the horse gained maturity and started to do better in herself, and then suddenly was more resilient to parasites. And we took a sigh of relief because the chemicals started to become more effective, the count stabilized, and she came through it, and she's now a healthy adult horse. But sometimes there just is this, you know, what's been going on in the horse's past. Often if they've had worm burdens and the problems have stayed with them, then that persists, and we have to manage that. So there's lots of different factors. So I'd absolutely encourage you to, well, give us a call in the morning or speak to your prescriber, go to your vet, really have a discussion that looks at all these different factors. And then there are things we can start to do to unpick that if you're still having problems. You know, like you can do things as well as reduction tests. We can do things like looking at when the eggs start to show. So like how effective are the wormers being for how long and that sort of thing. And trying to get to the bottom of it with you. But they can be just conundrums to begin with. Until you get to them, a lot to think about. But
Yeah,
sorry
no,
to
there
hear
is.
you're having that.
No, that's fine. It's really interesting because I think we've got all these testing options, and you've mentioned some of those other things, but what else can we do to reduce that risk for our horses? Poo picking, we've talked about that.
We have, although I've got this really cool little diagram which actually shows how effective poo picking can be. You know, doing your regular poo picking is as effective as giving a chemical. So we can see here different sorts, you know, they've actually studied this, which is amazing. So different manual, automated, and then no removal is that top line. And you can see how you get that really nice parabola through the season when you're removing those worm eggs off the pasture, and that's just allowing the horse to deal with the parasites effectively, and the counts are coming down on their own without giving treatment. So really, really effective way of minimizing chemicals in the horse.
Which one is the manual? Because is the manual the bottom curve?
It's actually, no, it's the black one. So it's slightly higher than the blue, which is the automated. But I mean, I guess between sort of 250 and 400, I'd say it was doing the same thing, if I'm being honest. And it's the general direction of play is the right direction. Yeah. Oh God, I'd love to have an automated poo picker, wouldn't you?
I was just about to say, wouldn't it be? I'm with you. I'm a wheelbarrow and poo picker. But yes, it's great to get out. It's a great way actually of observing your horses, I always find.
Yes.
It makes you spend time with them that you might not ordinarily spend. But then we've talked about dung beetles and the importance role that they play. Are they everywhere in the country? I mean, I'm lucky, I know I have them, but not everybody is lucky enough to have them, are they?
No, it's really patchy. And a lot of the time, it's nothing that you've done. It'll be what you're surrounded by. So either you're surrounded by farms where they've used a lot of chemicals, and unfortunately that's decimated habitat, or you could be in an arable area where, again, there's very little habitat if there's just your isolated horses within that. So whatever is going on in and around you, you've got to think of that. So they tell me that dung beetles can fly in for 10 miles to the right poo, which, like, I know. It's amazing. It's a bit mind-blowing, really, isn't it? But we have 48 species of dung beetle in this country. They're all tunnelers and dwellers. We don't have any rollers, unfortunately. You know, like if you see a dung beetle on a nature program, it's always one like pushing a big ball of poo, isn't it? But we don't have those. But we do have 48 different species, and they do so much in terms of like bringing the dung down into the soil. They will eat it. They will breed in it, and it does a lot for aeration of the soil and nutrition value of breaking down the worm eggs as they're there in the dung as well. So they're really great. They're nature's dustbin men is what they call them. So we've got a lot of passion for them, but it can take a long time to, especially if you're like a lone wolf and in wherever you live, to try and build that population. But if you have them already, do look after them, and you're very lucky.
And then we talked about rotating pastures as well as overgrazing with other species.
This was just a little bit of a rest and rotate every 6 months ideal. Get your stocking rate, but stocking rate's a hard one because, you know, if you've got fatties like I have, you know, you can't move them off where they're at. You know, they live on a track system. It's a grass track system in the summer, and there's no way they're getting onto any more pasture because they'd kill themselves, wouldn't they? They'd eat themselves to death. So you just got to do what you can do. But if you've got any sheep or cattle that you could put across, like, that's fantastic because they're species specific. And so if a horse worm gets into a sheep, then it's toast, which is great for the horse, not so for the parasite. But and then quarantining and testing new horses coming in, again, like a really key thing. Just making sure that whatever horse is joining yours is not bringing all these unwanted passengers with it. It's a really key thing to think about.
Yeah. So I think, and then so cross grazing. But I think overall we're really talking about changing what we do and how we do it. And, you know, you've been really in the forefront of this, and initiatives like Canter have been brilliant about really making people think about what they should be doing. But are we actually seeing changes? Because we're trying to reverse the behaviour of the last 30 years.
Yeah, I mean, absolutely, things have changed massively. So many more people are doing targeted parasite control than they were. And then, and you think, oh, like the tide is really turning and we're absolutely getting it. But then we do things like, I went to a trade stand last autumn and was horrified at the number of people who, oh yeah, they have 40 horses. Oh, they don't do any parasite control. Worm egg counting is too hard because there's too many of the horses. Or, oh, I've heard there's resistance to wormers, so I just don't use them, but I don't do any testing either, that sort of thing. And so things like that creep up and surprise you, but that's what we're there for, to try and spread that message. Or I was in the lab on Monday, and I think we had a succession of 2 or 3 phone calls, and there was of big livery yards that are just blanket worming. And the good thing is that they're reaching out for help and how to, but they're still out there. There are a lot of bigger yards where it's just easier to give the chemical. And that's the difficulty, because it's the land itself where the resistance develops. And so if you think about this investment of these businesses, the like big riding arenas, covered schools, cross-country courses, the acres of surface that a lot of these places invest in, and then all of a sudden you've got land where none of the wormers work anymore, therefore you've got disease from parasite infection, and it's not a good way to keep clients. And the only thing we can do then is really reduce our stocking densities, which then has that economic hit on it for the landowner, and you can't just up and move them to fresh pasture. So we've got to be starting to think about this, especially on our bigger places.
Yeah, and I think it is very difficult, as you say, on big yards. When you go onto a big yard, quite often you're asked to sign a contract, and sometimes in that contract, sometimes they're good and they'll say you are required to worm egg count your horses, worm test your horses. But I know from friends' experience in the past, the yard owner goes and administers wormers to horses regardless, which can be very, very difficult if you need to be on that yard.
It is, yeah. And I think what we hear from yard owners is they don't want to put extra pressure on their liveries. They don't want to have extra cost, inconvenience, change a system that has worked for X number of years. There's never been a problem. But then we also then hear from like liveries themselves who really would love a test-based program. They've heard that is the best thing for their horse. They want to implement it. And then often it is the case of getting those two things together, that the yard owner understands that actually that, change is always really hard, but actually it's not as hard as they thought it might be when you've got good support, good systems, and easy to use kit to do that, and a system to go in and collect the samples. And then we hear from liveries who actually, they say, oh, we floated this idea and everyone was really pro it and they loved it, and like it was way easier than we thought it might be. So it's just a case of opening those conversations and having from both sides, like, advocating. And if you're on a livery yard, ask for help, ask for programs, get somebody who can organize you yourself and everyone else to get on board, and make that change happen.
Yeah, because I think, just to conclude, we've got to think about what happens if we don't change, what happens if we don't act, what are we facing?
Yeah, that is the scary bit. It's having like no parasite control that's working in our horses, and then we're back to pre-1960s, which is basically horses that are dying of parasites and that we can't do anything about that. So that's a really scary place to be for the future, for the health of our horses. And but it doesn't have to be like that. If we affect our change now, then we can manage the treatments that we've got, and we can keep them effective for as long as possible, and things will come on board. These germs of ideas, things are moving. I think we've just got to buy ourselves time for as long as possible, and then hopefully we'll all be hunky-dory.
Well, let's hope so. I think it's really important. And just tell us, remind everyone of the website if they want to go to Canter to just see those the risk factors and how they can do a risk assessment, and also the Westgate website in case they want to touch base with you.
Yeah, so the Canter is canterforhorses.org.uk, and you'll find lots of resources on there and that Canter risk profile. And then we're at westgatelabs.co.uk, and you can get us on the phone, by email, on social media, so we're on Facebook and on Instagram, so you can get in touch with us through those channels, we'd really love to speak to you, to help you with your parasite control and support you going forward.
Yeah, that's brilliant, Claire. Thank you very much. It's been absolutely fascinating. I'm glad we've had some really good questions to help us, build out that discussion. Thank you very much for giving up some poo picking time of your evening.
You're really welcome. Thank you.
Thank you.